2. Number 3, omega-3s. Now, we had a big conversation. We already done a talk on omega-3s. Why is omega-3 the third thing you should be taking? Well, think about it. Excuse me. 95% of all diseases start with one thing in common: inflammation. The first thing your body uses to turn off inflammation is omega-3. Let's say it again. 95% of all diseases have one thing in common. They usually start with some type of inflammation. And inflammation is not always pain. People think that inflammation is pain. No, it's not. Inflammation is inflammation. You have inflammation in your arterial walls, and cholesterol builds up there as a protective mechanism, right? You don't feel that. That's not painful. But it is inflammation. Okay? So inflammation. 95% of all diseases start with inflammation. Your body wants to turn off inflammation. It needs omega-6 to turn it on. The counterbalance, it needs omega-3 to turn it off. If you do not have enough omega-3 in your diet, it's harder for the body to keep the inflammation down. We should be taking omega-3 every day. Omega-3 is one of the few nutrients that the body does not create. It is an essential fatty acid. That means your body does not make it. It needs to bring it in. It needs to ingest it. When it's essential, that means your body needs to get it in. Okay? Non-essential means your body makes it. So your body needs to make omega-3 your body needs to ingest omega-3 every day. Omega-3 is not only great for inflammation, omega-3 protects the brain cells. Okay? 40% of your brain is fat. And the best fat your brain wants to use is omega-3s. Okay? The outside of your cell wall that makes it, the outside of your cell wall that makes it more lubricated, that makes it more like flowy, if that's a word, flowy, is omega-3s. The phospholipids in that cell wall that helps it become more smooth moving, going through the body, is omega-3. Okay? That's bound to your phospholipid wall in the cell is omega-3. Okay? Omega-3 is so important. It's so important. When you start to develop high cholesterol, you have inflammation on arterial walls, the body sends cholesterol over there to repair. Because that area over there has damage, because it's damaged because of inflammation. What does the body need to turn off that inflammation? Omega-3. Your knees are bothering you. What does the body need to turn off that inflammation in those knees? Omega-3. You have eczema. You have psoriasis. You have dermatitis. You have skin issues. The skin is inflamed. You have bad acne. You have cystic acne. What does the body need to help turn off that skin condition, that overproduction? Omega-3. Your eyes are dry. They're dry. You're taking medications that make your eyes dry. Or your eyes are just dry and you don't know why. Well, what have they found? That omega-3 helps with our dry eyes. What else? We can keep going on and on and on. What did you say? What did you say? You on aspirin? To why? You on aspirin to what? Prevent heart attacks. That's what they say. Aspirin prevents heart attacks. Well, they just came out with a study that said the side effects of aspirin it doesn't like what's the word I'm looking for? The side effects are greater than the actual benefits. The side effects are actually greater than the benefits. So they're now coming out and telling people, maybe you should talk to your cardiologist about this baby aspirin. Maybe it's not worth it for you. Because baby aspirin's job is to make sure that you don't build blood clots, right? And it helps with inflammation. Well, guess what naturally thins the blood? Omega-3. You wonder, you have blood clotting? Remember, the way the body works, the mechanicism, the way the body works, you cut yourself. It gets inflamed. You cut yourself. The body says, hey, we need to get blood over there. We need blood over there to help this area heal. So what does the body do? It says, holy moly, we need blood over there. Grab me omega-6. Let's start inflammation. Inflammation dilates the blood vessels, get the blood over there. The red blood cells go over there, the white blood cells go over there. It fights the infection, it inflames it, it gets more blood over there. It causes heat because that keeps the bacteria away. It causes the heat so the immune system can start fighting over there too. And what else it does? The inflammation causes what? Blood clotting. Omega-6 will cause that blood to coagulate. Also some other things, but blood clotting, coagulation, to stop the bleeding. Once that thing stops bleeding, the body needs what? Omega-3 to says, we don't need you to keep clotting. We don't need the blood vessels to be so hot and open. Let's turn off this inflammation. Let's turn off this inflammation. Let's turn off this omega-6. Because now we don't want to make too many blood clots. And what does it say? The signal, omega-3, hey, omega-3 does its job, calm down the blood vessels, start to break up the blood clotting, stop the mechanicism of blood clotting. So omega-3 is extremely important. This is foundational health, people. This is foundational supplementation. Foundational supplementation. Omega-3. Okay? So that's some of the importance of it. We talk about baby aspirin and people take that. Well, you know, omega-3 is having a great, it's incredible when it comes down to cardiovascular health. Okay? And you should definitely talk to your cardiologist or your doctor about it. You know? You're talking about dry eyes. You're talking about dry skin. You're talking about dry scalp. You're talking about knee and joint problems. You're talking about 95% of all issues start with the same thing in common, and that's inflammation. And you could take a supplement called omega-3 that'll help deal with that. Now, you could take it in the form of flaxseed oil or fish oil or krill oil. Whatever form you want is up to you. But omega-3. I think fish oil is the best, but if you're vegetarian, do flaxseed. And if you can do krill oil, do krill. If you can't tolerate the liquid or the capsules, do krill oil. Easily digested, but you just don't get as much. You want to do at least 1,000 milligrams of omega-3 a day. And make sure you read the label to make sure it's EPA and DHA if you're getting it from an animal source. If it's from flaxseed, you're looking for alpha-lanolytic acid, and you need to do more than 1,000. You need to do about 2,000 to 3,000 milligrams of alpha-lanolytic acid a day. Okay? 2,000 to 3,000 milligrams of alpha-lanolytic acid. If it's in a form of EPA and DHA, make sure you read your label. You want a minimum of 1,000 milligrams of omega-3 a day. Okay?